Welcome to the meeting. So we are yet to have our speakers online.
One of them is here, and Dr. Sheetal will be joining in soon as well. We will start at 8, like 7:45 to 8 is the networking time.
Networking time.
Let's all use the similar background to give that feel of being there in person.
Meanwhile, I can practice the Zoom if someone is okay. The timer.
Sorry?
Timer.
Yes, you can check your timer cards.
Good evening.
Dr. Divya?
Yes, DTM.
Do you want me also to put up this screen?
Yes. I'll
Can
share
you
it
send
with
it
you
to
as
me?
well.
Yeah.
I'll share it.
Sure.
You have a presentation to share?
Yes,
you have
I
a presentation to share? Okay. So you can check on whether it is working for you. Toastmaster Prashant,
let me check.
we'll have to give her the rights for the
If
same.
there is, I do have the access, yes.
How can I have that background?
Thank you. I'm sharing it again with you, Canibet.
Yes, please. You're
Is
sharing it on the
possible
message in this group?
Okay, share it on chat or something. So then
Yeah, please.
Yeah. I have shared it on this WhatsApp also, personally to most of you, but I'll share it here as well.
DT Manju, can I ask you something? I can see mirror image of my background. Do you see the
Wait, there is a setting to be done. Yeah, there's a setting to be done. I don't know where yeah. So you will have to go to your, there are 3 dots that you can see on top right.
And top right, yeah. And that's required.
Okay, so adjust background and effects.
So that I've added, but are you seeing this mirror image, right? You're seeing not the right, these letters. They are.
No, I'm seeing the right letters. I can see District 1 to 7 written. Yeah,
fine. That's perfect. That's
there,
perfect.
it's there.
Okay, thank you so much. Thank you so much.
Toastmaster Canibeth, were you able to do it?
I'm trying. One moment.
Wait, I'll help you. Wait, just let me share the background here first. So you go, Canibeth, you can see on top right, you can see 3 dots on your laptop when you click on your screen. Okay, click those 3 dots.
Yeah, I think I have it now. Can you see?
And then you can see background, choose background and effect. You got it, right?
Yes.
Perfect.
Thank you.
Yeah, Dr. Sheetal is also here. Zoom Master is TM Prashant here, Toastmaster Prashant.
Yeah, Toastmaster Prashant, please pin me with the speaker so I can show my timer card also when our meeting starts. Yeah.
Yeah, I'll do that, but I'll leave the host, Anju.
Yeah, I will do it. He might leave in a bit. He has got some other meeting also happening. So I think he's made me the host. I'll do that for you. Okay, let us try it out now. I've pinned you here. Okay. And I will pin Dr. Divya also. Add pin. Okay. Perfect.
Yeah, so the other participant can confirm if they can see my.
Dr. Divya, can you see Toastmaster Akmal?
Yes, I can see.
Yeah, so he'll be changing his backgrounds as per your time things.
Perfect.
Yeah.
And
Dr.
I can.
Sheetal.
Yeah, I will
Yeah.
also, there is one timer. It will be also showing on my screen like this one, if it is
Yes,
better.
yes. The time is going on the screen. Yeah,
Hmm.
that's good.
So
Makes
from the
me feel like
start,
I'm in an exam.
so
Yes, yes,
so if the speaker is comfortable, should I start it from the start or like
yes,
just to show the colors?
yes, yes, you can please.
Okay.
Can someone help me with the background, please?
Yes, yes, Dr. Sheetal, sure. Okay, let me unpin them first and let me take you on the pinning thing here. Okay. I have shared the background with you on WhatsApp and I have shared it in the chat box here as well. You want me to share it again? Can you see it in the chat box?
Just 1 minute. Yes. Now, how do I take it on my background?
Okay. You
Sheetal, you will
click
find the
on
video,
your
no?
name on the top, you will see on your screen, you will see the three dots.
On my screen, yes, three dots.
Okay, click
Adjust
on those three
backgrounds
dots.
and effect.
Yeah, adjust background and effect, open that. Then you will see a
Okay.
plus sign there, virtual backgrounds and plus sign.
Virtual backgrounds, I don't see. Yes, the plus sign.
Okay, so
Add
there you have to
image.
first download the picture that I have shared it in the
Yes, I
chat
already
box.
downloaded it.
Yeah, so add it from there.
Okay.
Add image and then it will ask you where the image is and then you can take it
Yes.
from there.
Okay.
Yes, you
Yes.
got it.
Done.
Yeah, yeah, yeah.
Done. Thank you so much.
So your mic is working perfect. We got to test that while you were speaking, and
Yes.
you have a presentation as well, right?
Yes, I do.
Great. Dr. Ritu, we are waiting for you to welcome everyone.
Hello,
We are
everyone.
most
Hello. I'm sorry, I was trying to adjust my background like everyone else, and my daughter was helping me
there.
with that. Now I'm all set.
Dr. Sheetal, Toastmaster Akmal will be our timer. So I will just do a demo for you. I'll pin him and I'll pin
Okay.
you together so that you can see the timings as you speak.
Okay. Okay, fine.
See, where are you?
Hi, Dr. Sheetal.
Hello.
Good to see you here.
Same here. Happy to be on Toastmasters. I'm sorry my throat is bad today. You'll have to manage with a hoarse voice. But I didn't want to skip this by any chance.
Yeah,
Not
actually,
Toastmasters.
we all are
I,
waiting for the session because it is,
I could
as you
see
know, it's
Didi has joined us.
Yes, yes,
Yes.
yes. So
Good
now
evening,
you are
Didi.
I'm saying Toastmaster Sheetal. Dr. Sheetal, you are pinned with our timer here. Toastmaster Akmal, can you just go ahead with the timing cards and explain how it will go?
Yes.
Yes, Dr. Sheetal, pleasure to introduce you about the timing rule. So,
Okay.
first, my timer will be also screen showing on my screen.
Okay.
If you can
Yes, I
notice,
can see
there
it.
is, yeah,
Yes.
timing. And aside to this, I will change my background colors. Okay.
Okay.
Okay, so basically, Dr. Sheetal, you are assigned time of 20 minutes. I will show green, and
Yes.
on the count of 25, I will show you yellow color. And when you will complete, like touch the line of 30, so I'll show the red color. So from moving forward 30, it will be shown as red. So you need to finish your as wind up your speech like best
I
possible
think I
way.
should be done by then.
Yeah, best possible way. And
Before
that's
the yellow card, hopefully.
yeah. From the red card, you need to be just
Yes.
mindful. Okay, thank you.
Okay.
If you have any question, you can still ask if you're not sure. Yeah,
No worries. Looks
thank you.
good. Yes.
Thank you.
A warm welcome to our district director, distinguished Toastmaster Sujil. Thank you so much for joining us. And
Warm welcome, District Director Shaki. Yeah, nice to see you.
Good evening, everyone. Good evening, everyone.
Good evening.
Good evening, Anjuji. How are you all?
good evening, good evening. All good.
Nice to see you all this evening.
Thank you.
DTM Anju, ma'am, will I get this share screen right?
Yes, yes, definitely.
Okay, thank you.
Multiple participants can share simultaneously. Now check. Yes, you get it. We have our district PR manager as well here, Toastmaster Jinal. Good evening, Toastmaster Jinal.
Good evening, Toastmaster Jinal.
Good evening.
Happy good evening.
Happy good
Happy
evening.
evening.
Happy evening. Happy evening to all of you.
Yeah.
Yeah, that's the mantra for the happiness team.
Yeah.
Thank you
I'll
for spreading the
reshare
happiness.
it's a combined effort for all of us. Our district advisor is also here, Distinguished Toastmaster Nelson. Welcome, Distinguished Toastmaster Nelson. And
Good
thank
evening,
you
good
for
evening.
joining us and supporting us for this noble cause.
Yeah. Wonderful initiative. Congratulations to the entire team.
We have Toastmaster Anne from the district committee as well here. I have shared the background in the chat box. If anybody wants to use it, please proceed with it. We'll be starting in another 2 minutes. The VP Ed from India Club Toastmasters is also here, Toastmaster Rashmi.
Hi, good evening.
Good evening, Toastmaster Rashmi.
Good evening. Charu, you can start in another 2 minutes. It's
All right, ma'am. It's I think 1 minute to go.
7:58.
Oh, 58. Fine. Mine is showing 59. So, right.
Yeah. Now it's 7:59.
Okay. Good to go, ma'am? Good evening and welcome, fellow Toastmasters and distinguished guests, to Breast Cancer Awareness and Mental Health Care Session, an initiative by Happiness Team of District 127. I am Sergeant at Arms Toastmaster Charu Rathore, and I welcome you all to this thoughtful event. I would like to begin by stating the mission of District 127. We build new clubs and support all clubs in achieving excellence. Some ground rules to be followed during the session. Number 1, please turn off your mobile phones or put them on silent mode. and keep any electronic devices away. Number 2, please put yourself on mute if you are not talking. Number 3, please turn off your video if you are stepping out of the meeting. And please refrain from talking about taboo topics, sex, religion, and politics. Now, since it is an initiative of a happiness team, we ought to show some happiness. We will do a simple exercise of laughing loudly by stretching our arms. Our arms like this, it goes like V. Okay, with the background, it might not be that visible. I will say ha ha, and you'll follow and say ha 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 4 times. And we will repeat this 3 times. So we'll follow the pattern 3 times. Here we go. All right. Ha ha.
Ha
Ha,
ha.
Ha ha.
ha,
Ha ha.
Unmute yourself, please. Yeah, everyone. I'll start once again. Unmute yourself, everyone. I forgot to mention that. All right. All right. We go once again. Ha
Ha.
ha.
Ha ha
Ha
ha
ha.
ha ha
Ha ha. All right.
Ha
Ha
ha.
ha.
ha ha ha.
Ha 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 ha. Ha ha.
The presentation going on.
Ha 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 ha. I can't listen to people.
Ha 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 ha.
Okay. All right. All right. Without further ado, since I got a green light over there, I would like to invite our happiness chair of District 127, a Toastmaster since 2014, one who loves to see others grow and empower them. Currently a mentor and member of India Club Toastmasters Club, which was founded by her during her term as an area director. She has served at various levels in Toastmasters, an educator, environmentalist, author, yoga instructor, winner of Food Shala, season 10 on Star Plus, a superwoman who is now a happiness coach. Let's put your hands together for energetic, distinguished Toastmaster Anju Chatwani. Over to you, ma'am.
Thank you so much, Toastmaster Charu. I am glad, I'm very happy to be here this evening. And I know we are very few in number here, but this few will also count toward the betterment of someone in our family for sure. These both topics are very close to my heart because I have been facing my mom passed away with breast cancer, and we have a child with mental health issues at our in our family as well. So it's something that we can do and we can give to our society in return, something that as Toastmasters we can share and we can help others to support someone in their family as well. May God forbid nobody should have these things, but this is life, right? It doesn't come with any guarantees and warranties. So we should be best prepared, like we are prepared with our speeches, like we are prepared with our mm, what to say, another events. This is also something to be prepared for as life comes with unexpected gifts and surprises. And I'm very thankful to the district director of our district 1 to 7, the distinguished Toastmaster Sujil, for providing the happiness team this opportunity to conduct this event on this level. And without further delay, I will now introduce our energetic MC for the day who will be carrying on from here. And she is none other than Toastmaster Kenny Beth. And let me go to her introduction she has sent me. Sorry.
Mhm.
Yes. She is a passionate Toastmaster and belongs to E and Toastmaster Club. And she is a table topic contest champion of 2024. And she's a trainer for E&E business. And that's it. And more we'll get to know when she comes here and takes over the stage. Over to you, Toastmaster Canibet. All the best, and let's give our best to this event.
Thank you, DTM Anjo, for that warm welcome. Good evening, fellow Toastmasters and distinguished guests. How's everyone doing today?
Great, great.
Everything is great. I know we are all
Great.
carrying our loads for today, right? But we are going to have some fun, all right? So it's an honor to welcome you to this great initiative brought to you by the happiness team of District 127. So again, welcome to today's education session on breast cancer awareness and mental health. We all know that these two are the vital topics that impact millions of lives worldwide. This session, everybody, is an opportunity to learn, to reflect, and take action to support ourselves and those people around us. So today, we encourage you to listen, engage, and take away meaningful insights that can inspire change and make a difference. So now, let us dive in and make this session impactful and memorable. And we would like to thank you all for being here today. Let me just take a line from our slogan, right? It says earlier, and DTM Anjo also have said this in the beginning, but I will repeat that for everyone who's here today. So we know that breast cancer is not only for women, yeah? So men are at risk as well. And mental health challenges can affect anyone regardless of age or gender. We all know that our awareness saves lives and conversation build strength. So it's now time for us to talk about it. Now, I have said enough, so let us kick off this event. Let us meet our role players for tonight's session. I will start with our greet master. So you have heard her earlier greeting everyone before we start our meeting. So let's know her in this session. She is a doctor by profession and a Toastmaster for the past 2 years, currently serving as the Assistant Area Director and also a Program Quality for Area 11. Also a charter member of India Club Toastmasters Club, where he had the privilege of serving as the treasurer for the last year. Whether he is holding a stethoscope or a microphone, his mission remains the same to make people feel better. Let us put our hands together for our great master, Dr. Rito Kapoor. All right, now moving on to our next role player, our Zoom master. He is an entrepreneur and an aircraft engineer. I get this one from his LinkedIn profile. Hopefully, I was able to find the right one. He was with Emirates Airlines for so long until he changed his passion. His core values are integrity, professionalism, and trust. Ladies and gentlemen, let us welcome our Zoom master for today, Toastmaster Prashant Gurbazani. All right, thank you very much. Now moving on to our next role player to ensure that no one talks out of schedule. Hopefully, it's not me. Our timer police for today's session. He is an experienced senior accountant with a strong background in managing diverse financial operations, including accounts payable and receivable. At Toastmaster for the last 2 years, and a vice president education of A&K Global Professional Toastmaster. Let us welcome Toastmaster Muhammad Akmal Zia. Welcome and thank you. Now, everyone, we already met our wonderful role players for tonight. So let us move on. Before we dive in further to our discussion, I know that everybody loves him, so we need to hear his welcome address today. He is a talented and results-driven senior civil engineering management professional. He brings with him over 19 years of rich experience in project planning, execution, and design. He is turning blueprints into landmarks across UAE and India. His professional journey is marked by precision, dedication, and a passion for building excellence, quiet literally. But beyond the world of structures and site plans, lies another side of him, that of a passionate Toastmaster. Having served in various leadership roles, including as a district program quality director, he continues to inspire, mentor, and uplift others to find their voice and grow as a confident communicators and leaders. Please join me in welcoming to provide his welcome address, the District 127 Director, our distinguished Toastmaster, Sujil Chinakandi, a man who not only builds great projects but also builds great people. Ladies and gentlemen, over to you, Toastmaster, distinguished Sujil Chinakandi. Over to you, sir.
Thank you, Toastmaster Kenneth. Fellow Toastmasters and distinguished guests, very warm good evening. A very special good evening to a happiness team led brilliantly by DTM Anju Tatwani. When we think of Toastmasters, we often focus on skills we see, like the confident speakers on the stage, the powerful leadership. But tonight, we explore something beyond that. The foundation of everything, which is the serious side of it, which is the mental health and fitness. Once again, our happiness team has done wonderfully well in organizing an event which is of paramount importance. Think about it when we get onto the stage, or rather be an evaluation. Always there are butterflies. Always there is tension which is running through our mind and body. How do we overcome that? That is where the resilience comes in. Today, we will learn how we can tackle this and how important health is for a Toastmaster, not only a Toastmaster, for that matter, any human being. District 127, we don't just build better speakers, we build stronger and more resilient human beings. We are, in essence, a gym for the mind. So today, let us eagerly listen to the wonderful keynote speakers so that we can add that little bit so that our journey in Toastmasters will be even more fruitful, and let us enjoy it more. Thank you all for being here this evening, and let us enjoy the session and learn a bit so that moving forward, we will be better human beings, better Toastmasters. Back to you.
Thank you, DTM Sujil, for that warm welcome. Indeed, we are going to park right now making speeches, right, and answering our table topics. Now is the time for us to learn more on our two vital topics for today. Now, let us go ahead and introduce our first speaker for tonight's session. So, our first speaker is a specialist obstetrician and gynecologist with over 22 years of experience providing comprehensive care to women of all ages. She earned her degree and diploma in obstetrics and gynecology from esteemed BJ Medical College in India. Furthermore, she has undergone specialized training in ultrasound, laparoscopy, and fertility and reproductive medicine. She is committed to staying updated on the latest advances in her field and regularly attends conferences to ensure that her patients receive the best possible care. Ladies and gentlemen, let us welcome our first speaker who is going to talk about awareness for breast cancer, a specialist and obstetrician and gynecologist, Dr. Shital Vadia. Over to you, Dr. Shital.
Hello, everyone from Toastmasters. I'm sorry for my throat. I'm going through a bad flu. So you'll have to tolerate a little bit hoarseness. But I'm ready to share my thoughts and my knowledge on this. Let me start with my presentation first. Just a minute. Okay, so I hope you can see my slides. Yes. Okay. So you've already introduced me. Let me go to the next slide. And just a second. I am not able to share or change here. Oops.
Time you press the arrow key.
Yes.
Yeah.
Yes, it's done. It's done. Okay, so let's talk about the Pink Initiative. The Pink Initiative, in my language, people know it as a Pinktober or many more names. But for me, it's practicing what you know. That's eating healthy, being active, not smoking, and avoiding drinks. I stands for investigating the information rightly. N stands for knowing what is normal. So until you do not know your normal breast structure, you can never find out what is abnormal. And the last is K, which stands for knowledge, which is power. Only if the knowledge comes from the right source. And by right source, I mean not Google, right? So the goal of screening for cancer is to detect preclinical disease in patients who have not yet developed any symptoms. That's the reason we do this Pink Initiative. So breast cancer can be cured if it's diagnosed early. As you can see in the images, stage 0, stage 1 and 2 has survival rates as close to 93 plus. However, as soon as it spreads to stage 3 and stage 4, the survival rates drastically reduce to 70 and then to below 25. And that's the reason Pink Initiative plays a very important role for diagnosing asymptomatic cases. Now let's talk about a few myths. Only women with family history get it? Not at all. The youngest survivor of breast cancer is a girl of 21 years old who had no family history of breast cancer. The second being most breast lumps are cancerous. Let's understand that more than 95% of breast lumps are not cancerous. Only women get it? Not at all. In the last 2 years itself, there's close to 5,000 men who have got breast cancer, and many of them have lost their lives to it too. So let's not live in this myth. And the last being, breast cancer always comes in the form of a lump. Not at all. It can come in the form of multiple symptoms, which I will be coming to step by step. This is the anatomy of a female breast. The difference between anatomy of a female breast and a male breast is the only difference is there is no ducts and lobules. The lymph nodes chain and the breast structure stays the same. Now let's understand what a tumor is. For example, I get hurt here. One cell divides into two. 2 divides into 4. That's how controlled the division is supposed to be. However, in cancerous cells, one cell will divide into 2 and 2 can divide into 2 million. So this uninhibited growth of the cell is known as cancer. The tumors can be of 2 different varieties. One is benign tumor, which means it's a localized lump and is not going to cause any growth or side effects. The second is a malignant growth. The malignant growth starts at one place, but through blood circulation and lymphatic circulation, it spreads to different organs, to as far as the brain and even the feet. Now, who are at risk for breast cancer? Looking at this slide, you might feel that everybody is at a risk. Well, that is true. The first one being age. Age is very important, especially because early onset of periods and the late menopause, the exposure of the breast and the ovaries to the gynec hormones has lasted for a very long time, and that itself increases the chances of abnormal cells and breast cancer. Nulliparity or conceiving late in life because of the revolutionary changes we are seeing where women are more career oriented. The first pregnancy is usually at a later age nowadays, and this also increases the risk. Breastfeeding is a protective mechanism, and so no breastfeeding again becomes a risk factor for breast cancers. Some races have been known to have higher risk of aggressive tumors and some have lower risk. So your race is also a predicting factor. The individual history or family history of somebody having breast cancer or ovarian cancer also plays an important role, which I will be mentioning in later steps. Estrogen exposure, the kind of tablets that girls and women nowadays pop without physician consultation can cause increased estrogen exposure, and that causes a risk to breast cancers. Lifestyle factors, we are all aware: obesity, lack of exercise, sedentary lifestyle, alcohol, smoking, all of these add as a risk factor. And the last is radiation. Any prior radiation in young age can also increase the risks of breast cancer at a later age. Now, I'm sure you might not have heard about the BRCA gene, but everybody's heard about Angelina Jolie. Well, Angelina Jolie is known because of not just her Hollywood career, but Angelina Jolie is also known because she was positive for BRCA1 and BRCA2. She lost her mother, her aunt, and her cousins to this disease. So she decided to get a mastectomy done even before she develops any symptoms. These are two small genetic structures in your chromosome 13 and chromosome 17. A check for this with a simple blood test can protect you against breast cancer because screening becomes even more rigorous when you are known to have BRCA positive. So one female in the family having breast cancer increases your risks by twice. Two females increases the risk by 5 times. And a similar risk is also seen with brothers, fathers, and a male in the family. What are the symptoms? Any kind of new lumps, thickening, nipple discharge, tenderness, puckering of the skin on the breast, just like an orange puckers as it dries out, warm, red swollen breasts. All of these can be signs, and women tend to neglect them and delay their visits to the doctor. Pain is usually not a sign. However, it can be seen in last stages where the breast is completely involved. And the last group is why I am here, and that is no symptoms at all. That is the time where doctors want to start finding out whether you have any risk of breast cancer. When to begin the screening? Well, the screening can begin as early as young girls. Self-breast examination is one of the best ways. However, you need to meet a doctor if you feel any lump. Every 1 to 2 years, it's always good to get examined by a clinician. And if you are above 40 years, then please get a mammogram done at least once in 2 years. Once you've done 5 mammograms, you can stop getting them done and you can do them customized based on what your practitioner tells you. The women with higher risk need to get more screening done and more rigorous ones. They can go for annual mammograms after the age of 35 years. How is cancer evaluated? Now let's understand. There are loads of ways of evaluating any disease. The first one for a breast cancer is always a screening or diagnostic mammogram. What is the advantage? I'll come on to it next. Then comes ultrasound, MRI, biopsy, which I will be discussing one after the other. Blood tests and other tests can be done to find out whether you have spread of disease or not. Now let's understand early detection. The first sign of early detection is self-breast examination. This does not include just examination with fingers. It also includes visual examination. So first is in the washroom, when you are just done with your menstrual cycle, that's the best time to examine, right? So visual examination is first by raising your hands up, putting them at your waist and bending down. These are ways of visual examination because the breast is a wobbly organ. It's like a bag of rice with a marble as a lump. So it's going to be difficult to find it. But visually, when you examine, the breast will change structure. The second comes palpation with fingers. Remember, we examine with these 3 fingers. You don't examine with the top 3 part because that's very sensitive. You might overdiagnose the lump. And you do not examine with the bottom part because that's less sensitive. So you might miss out on a lump. You can choose which way you want to examine, whether you want to examine the breast vertically, going one step by the other, or you want to examine radially, starting from the outer side to the inner side. And the last one and the best one is to examine concentric circles. So you go examining from the outer side of the breast, going all the way to the center, then check for nipple discharge, and in the end, check your axilla, which is the armpit. because that's where the lymph node chain goes. Now let's understand that breast examination is not 100% accurate. And that's the reason you need to move to further tests if you find something. The first one is an ultrasound. I'm sure you can make out that in the two images of ultrasound, one is a black colored hole and the second one has white speckles in it. Tumors are usually tough masses or firm masses, and they will look like something is there inside. The black one is a simple cyst. Then comes a mammogram. A mammogram is a situation where the breast is pressed between two plates and radiation is passed vertically, horizontally, and diagonally. The procedure does not take more than 1 to 1.5 minutes. However, it is one of the easiest screening methods to diagnose breast cancers. It can diagnose something as small as a pea size also. Then comes an MRI. An MRI is just the opposite of a mammogram. You can see the first image here where you see a peanut-sized lump. In the second image in the MRI, you can see the lump which is black. Because in an MRI, the normal tissue is going to take up the dye and the cancerous tissue will not take up the dye. And so this is confirmatory. A breast biopsy is close to 100% confirmation, where a needle is poked under local anesthesia, fluid is removed and sent for histopathology. And then comes the treatment. Now let's talk about baseline treatment. We are all aware that surgery is the best. However, there might be chemotherapy or radiotherapy around the surgery to reduce the size of the mass. And after surgery, you might again need chemo or radiotherapy so that the edges of the operative is also free from any cancerous cells. To our bad luck, there is no vaccine. Like cervical cancer has a vaccine, but breast cancer does not have one. So we do not have any vaccines, and that's why early screening is the most important step. Hormonal therapies like tamoxifen is used after operative procedure to keep the patient free from diseases. There are many other therapies under research, but one of the best ones is freezing the breast cancer cells to death. And then our body removes them with lymphatic systems and throws it out. This is under research in Israel and is being implemented at many hospitals across the United States. And we should be seeing hopefully good results where the women and men with breast cancer do not need to undergo a knife. Now let's talk about breast cancer survivors. Let's understand that there are lots of images here. The one I'm going to focus is the second one and the first one. One of the most important and unimportant things about breast cancer is that it doesn't just affect you, your life, and create a threat for the life, but it's going to actually give you a lot of emotional issues, major identity crisis, self-esteem, and even feminism and body image. Each of these is affected, and that's where mental health is also affected, because this affects the physical, the emotional, and the practical approaches, because people around the survivors are also affected. Your relationships, your anxiety, your heart, your nutrition, your cognitive issues, your feeling of hopelessness, each of these affects a woman or a man when they go through this disease. Now I'm going to take 5 slides for prevention, because prevention is your best defense. So maintaining a healthy weight with regular exercise and a nutritious diet. Breastfeeding is a sure shot 100% protection. Limiting cigarette smoking and any kind of substance abuse, and limiting popping pills. The good news is you can protect yourself from cancer, because every human being has cancer cells in their body. The abnormal cells are thrown out by our body by a process called apoptosis. The bad cells are not thrown out of the body when you're exposed to substance abuse. Your genetic structure is a risk factor. The chemicals used by our body, cleaners, environment, loads of other epigenetic factors which can affect and cause cancer cells to grow. Diet being one of the main. Healthy eating usually begins by learning how to eat smart. It's actually not what you eat, but how you eat it. A pastry at 10 in the night might be very harmful. However, if it's eaten at a lunchtime, it's not that bad because your body has a time to digest. A healthy diet and lifestyle has been known to protect and prevent 40% of cancer cases across the world. And basing our diets around plant-based foods, vegetables, fruits, whole grains, beans, legumes, and fibers are very, very crucial because they have nutrients that can fight cancer. People often think that by negating one part of the diet, like not eating fats, not eating carbs in a keto diet, or an ABC diet, XYZ diet, there are loads of diets. However, despite all the fat diets, we need to understand that a balance of carbohydrates, proteins, fats, minerals, and vitamins is the right foundation for healthy meals. The first important part of a meal is fiber. We should have at least 20 grams of fiber in a day. Where does this come from? Fruits, vegetables, your whole grains. The advantages of having fiber is, number one, it helps things moving. So the defecation is easier. Constipation is one of the most deadliest diseases in today's world because it affects everything from the gut to diabetes. So fiber helps in taking care of that. Then comes, it feeds your bugs. We are all aware that our gut is made up of 300 trillion microbiomes. The good fiber feeds these. Then comes, it helps you lose weight, helps you control cholesterol, even your sugar levels, and it helps you protect against other lifestyle diseases. Now let's understand, when we eat foods, we know that our kids don't eat colored diets. Try and make it a point to instill this from the beginning of their childhood, because every single vegetable, fruit, or plant-based meal is known to have a purpose in the body. As you can see, white foods play an important role in the immune system, like the onion, the humble onion. Beauty, vitamin C, yellow, cancer prevention, orange, carotenoids. The heart health are the red ones. The purples are for longevity, and green works for detoxification. There are many foods that actually protect you against and can fight cancers, like all the colored foods that we see, even garlic, onion, ginger, citrus fruits, green teas, soybeans, even seeds are all protective against cancer. Let's understand how to read labels. So if you look at this label, anything above 20% is not good, and anything below 5% is not good. If you can see in this, the fiber content is 0. That basically means this is a piece of junk that I have gobbled. So let's learn to read labels, because we do eat packaged foods quite a lot. 3 practices which I help every single patient of mine is eating according to your genetic structure. Like, for example, I'm an Indian. If I eat a salad at night, I would bloat like a buffalo. So it's best not to go against your genetic structure and force food on yourself. Second is intermittent fasting. A very good method, but it's not a fad. Do not make it a fashion statement. Intermittent fasting should be followed as a permanent lifestyle change. Even if it's only for 12 to 14 hours, it is very, very advantageous in the long run. And the last one being circadian rhythm, means eating with sunshine and stopping to eat around sunset. I don't say don't eat at all, but try and be as close to sunset as possible, because that way your body is in sync with the nature's biological clock. Drinking lots of water. We're all aware 75 to 80% of our bodies are made up of water. Not having water throughout the day is a problem. Having a liter in the morning and a liter in the night doesn't do the job. So divide it into equal amount throughout the day, because it helps in your metabolism also. Being active, very, very important. 30 to 45 minutes of activity, at least 3 to 4 days a week, because physical activity can not only change your physique, it can change your mental health, your emotional health, and even your psychological health, which I'm sure Dr. Divya is going to take after this. Lifestyle. We all love to be that couch potato, the cat. However, it's very important to find an accountable buddy and have an active lifestyle. We all have stress in our lives. My definition of stress is senseless thoughts repeated endlessly surrounding ourselves because we create the stress. People do not give it to us. Our body tends to, and our thought process tends to. So let's learn to be more calm while taking care of our diet. And circadian rhythm, I've already mentioned. Something about circadian rhythm here is when you expose yourself to 10 to 15 minutes of sunshine in the morning, it triggers hormones like dopamine, oxytocin, serotonin, and endorphin, which helps in keeping us healthy. At the same time, the serotonin in 12 to 14 hours is going to help us secrete melatonin, which can put you to sleep. So let's use our body's miraculous mechanism rather than popping tablets. Very important to use relaxation techniques. Choose your technique. My best technique here is self-talk. Every single morning since last 2 decades plus, I look at the mirror and I tell myself, I'm the best, I can do it because I'm a winner and God is always with me. Because nobody's going to come and tell you that every day. Might as well share it with yourself. So choose the kind of relaxation techniques in today's modern world and fight diseases. COVID has taught this. Living in the moment is very important. Let's stop living in the past and let's forget not live in our future. Accept life as it is. And gratitude, something each one of us has learned throughout this life of COVID. Gratitude is something which has been researched immensely in today's world. And in our tradition, we do know that we even pray to the food. We are grateful for what is on our plate. The same way, gratitude for everything around you can increase can fight stress, work for your mental health, and has many more advantages. That's my last slide where I'm trying to say that a colorful diet, a good lifestyle, taking care of your vitamin levels, your iodine, magnesium, selenium is very important to fight diseases so that your lymphatics is working well and you can throw out damaged cells from your body. My conclusion is modern life is usually full of hassles, deadlines, frustrations, demands, and stress is very, very common. However, stress is not always bad. Some stress is very positive, like when you're sitting in your company and you're trying to achieve a target. That's called positive stress. But negative stress is something that's constantly running in the background. And if your body starts feeling it, it starts running in an emergency mode, and your body tends to suffer and pay a price. With today's running world, we tend to neglect our body signals. So, my last message is learn to listen to your body while taking care of yourself and preventing yourself from any kind of diseases, not just cancer. And I think I am done with it. And if you have any questions, I am absolutely fine, or we can take it later on too.
Thank you very much, Dr. Shatal, for
Thank you
the
so much.
very informational session. Indeed, tonight it opened our eyes on a lot of things that we need to consider in our daily lives, and we're going to bring it with us daily
Yes,
to avoid this. Thank you very much. The Q&A
thank you so
questions, we
much.
are going to do that towards the end of the session. Thank you again for those informative session. All right, now that we've heard couple and a lot of information, more than we exactly need even about breast cancer awareness, let us move to our next topic. Okay, now our second speaker is a highly qualified and CDA licensed psychologist with more than a decade of clinical experience. She is registered with both the Rehabilitation Council of India (RCI) and the Community Development Authority, which is CDA, bringing international expertise and cultural sensitivity to her practice. She earned her clinical psychology from the prestigious National Institute of Mental Health and Neurosciences, which is NIMHANS, India, in 2013. Currently, she practices a Nafsology Psychology Center, DMCC, and Kids Neuroclinic, DHCC, where she continues to provide evidence based intervention tailored to the needs of her client. Fellow Toastmaster, let us welcome our next speaker, Dr. Divya Salyan, a clinical psychologist. Over to you, Dr. Divya.
Thank you. Thank you so much. I love the energy of the group, by the way. It's fun. Yeah, so looking forward for more such sessions. I'm really excited to have today's session. Can you all see my screen? All right. Okay, just a minute. Okay, so I just thought I wanted to talk something which is really, really prevalent in the current generation. It may be both for men and women alike. And there is a huge connection between stress and cancer. So I thought let's just put all this together and try my best to give you some tricks and tips on how to balance yourself, which is extremely important, but I feel it is the most difficult part of today's life, right? Okay, so two important parts of our life. That's work and our personal life, which has messed up a lot in the current era where we give a lot of importance to work because we feel I usually think about this dialogue that I keep telling my friends and family that work is to make life easy, but unfortunately, it's making it more difficult, right? So in the ancient times, people used to work just to have a comfortable and have basic necessities of life, but now the whole concept of work has changed, which is making our life much more difficult because of the demands and the competition we have. And we feel that if we don't perform to a certain level which we have conceived in our mind, then we wouldn't be good enough to continue with that work, which makes things not easy, of course, but then it affects all our aspects of life, right? It's sad that we always currently feel that work is the heart of life, while it is just a part of life, which makes things really difficult for us to ease out and let go of a lot of things. Now, it's very important to have a balance between your personal life. When I say personal life, I'm not just talking about a family life. I'm talking about your life. So me time. There's a lot of importance I give to you yourself. So when I say personal life, it's personal. It's just your time. When we talk about work-life balance, people usually think that work is just people going out, earning whichever work that pays you. But then I believe that work is also the work that doesn't pay you. It may be taking care of your children, it may be working at home, it may be cooking, cleaning, a lot of things which are not considered as work. So here I'm putting all the work that you do together and the personal life. So there are these two aspects. Okay, so I'm balancing these two aspects. Now, why is it important? Now, when we look at reasons for poor work-life balance, there are lots, but I've just put up a few. Increased responsibilities at work. Now, again, I'm repeating, it's not just work that you're going out and doing in an office. It's work related to your family responsibilities as well. Working longer hours, of course, you come back from work and you have to do all the household chores as well. Where is the time for yourself, right? Increased responsibilities. So this is having children. So let's just come to the pointers where I want to focus on what are the consequences of overload of work, right? So burnout is the first and foremost thing, because beyond a point, even though we do the most favorite job of our life, we enjoy doing whatever we do, when we overload ourselves with too many other things, everyone will experience burnout, right? So I'm just giving you some signs and symptoms, because a lot of people do not really understand the difference between burnout and depression or anxiety, because everything looks very, very similar, right? So, and most of the time it just goes unnoticed as well. You might be irritated after coming back from work, or you might be just lashing out at people. It looks like, to the other person, that it looks that you are frustrated, you are having a mood swing and hormonal changes, but it can be something else as well. So some symptoms of is exhaustion. So you feel tired even though you had a good night's sleep. You just don't feel like getting up. You just feel tired most of the time in the day. You dread to go to work, so it doesn't excite you to go to work. You just feel that, God, I have to get up and go. It's just that, people work for the monetary benefits, but they're not enjoying their work, right? So there's also trouble sleeping, depression. You feel that you're drowning every day into a loop. You're not able to come out of it. Temper, short temper, right? So there are these are kind of a very brief signs and symptoms of burnout. But I would say that please understand, it is a very common part of today's life, right? Because we don't get space for ourselves. This is why we feel the burnout. When we don't give ourselves that time out, and when we are too much involved and over involved in our work, burnout is something that by default will come at some point in your life. Okay, so on mental health, now, when burnout reaches a particular stage, when it goes a little beyond just burnout, all these symptoms of depression and anxiety will come up, which is kind of a clinical clinical significance. So when you feel all these burnout symptoms, it's better that you take professional help as soon as possible, or follow the tips that I would be sharing with you eventually. But if it is going beyond a point, it can reach to a lot of mental health, clinically mental health concerns. Okay, so 8 signs of depression. So you feel very anxious almost all throughout the day. So you feel jittery, you feel that hopelessness feeling, that there's nothing, there's no life beyond this. You always are experiencing mood swings. So if you can see, there are a lot of things that are very similar to burnout, but it's just that the intensity is much more severe than burnout. Um, Change in body weight. So some people in depression eat a lot. Some people eat very less. So there is either they put on weight or they gain weight, right? So uncontrollable emotions. They themselves cannot realize that why are they reacting in the situations wouldn't require such a reaction, and previously they never would have reacted in such a way. So the reactions and emotions are very uncontrollable. They can cry without reason. They just feel like screaming or crying or just being alone, right? So insomnia, uh, of course, in a much later stage, suicidal tendencies or even ideations are very, very commonly seen in depression. A lot of negative thoughts. So you keep thinking a lot of self-blame. You're good for nothing. This is all because of you. So there are a lot of negative thoughts which lead to all these symptoms of depression. Anxiety, another mental health concern, which is very, very common. So I picked up the two which are very commonly seen in the current generation. So anxiety attack symptoms would be like sweating. So when anybody is having an anxiety attack, you have excessive sweating, you feel like throwing up, you feel nauseous, you have tremors, you feel there is tremors and shaking in your hands and legs, you feel very agitated, there is palpitations, severe feelings of panic, that you feel that this is very dangerous, so the situation is very dangerous, and of course shortness of breath, so it's very difficult for you to breathe normally, so you may experience shallow breathing or fast breathing. Okay, so I'm just running through this because I have only 20 minutes. I think each of these topics are to be discussed alone. So I'm just rushing through because I want to talk more about the tips on what you can do to take care of yourself, right? So what do I do now? So if you're experiencing any of these or even burnout, now these are the things that I would recommend my clients to start doing in a very early stage. So first is know your worth. Okay, so it's very important that we kind of forget to give value to ourselves. We will value everything else in life. We'll value our car, we'll value our house, we'll value our children, our family, but we always forget to value our worth. So understand, know who you are, know what you want, know what you deserve. So when you start experiencing and when you start feeling all these things, you will understand if you are in the right place and what steps you require to do. Because what happens is, may it be men and women both, if you are holding on your family, if you are the sole person, most important person in your family, may it be you are taking care of a family inside, or you're taking care of your financial support, going working outside, whatever it is, you always tend to forget yourself. So you're busy earning, or you're busy cooking and cleaning and taking care of the house, but nothing for yourself. So I feel that just going and sitting in a salon is not it's not just enough to understand your worth, right? So it is just better, but that's not what I'm talking about. Okay, so understanding your worth will give you a lot of idea of how much time and efforts you need to take for yourself. It's exactly how much, if you're giving 2-3 hours at other things, please try to pick up at least 30 minutes for yourself. So that is how you have to understand your worth, because you feel that others are so worthy and so important. That is why you're giving so much time, right? So once you know that how important you are, because I always feel that you are your first child. Nobody can take care of you like how you can take care of yourself, right? So it's very easy for people to connect when I say that, okay, if this thing happens to your child, what would you do? Right, so that's when you as a third person perspective, it's easier for you to understand what wrong are you doing to yourself, right? So step back, think you are your first child, leave aside others, think this, and then you will get more clarity on how much you are in the whole journey of thinking that I should be a perfect mother, I should be a perfect father, I should be a perfect child, right? In the whole journey of being perfect to others, you're being most imperfect to yourself. Okay, so take care of yourself in that way. It gives you more clarity on how you can take care, right? Okay, now next is time management. Now I understand that some things can just come up randomly without any plans, but that's okay. Take good 30 minutes to 1 hour for yourself, no matter what happens. Even if your child is having an exam, even if you are having a meeting next day, good 30 minutes is not going to do any bigger harm. Okay, it's just that we exaggerate and we think that no, it's going to be the end of the world in 30 minutes. I'm going to waste so much time. So when you are thinking that you're wasting time, which is a time that you're investing on yourself, then that's when you have to think, what do you deserve? Okay, so keep all these things aside. It's fine, you're doing all these duties, but make sure you manage your time for yourself also. Like how Dr. Sheetal said, it's all connected, right? You're giving your time, you go out on a walk alone, you just spend time outside, or just sit in the evening and just meditate. Everything is the time that you're investing on yourself. So it's not waste of time, it's an investment. Okay, so focus on your health, which is most of the part Dr. Sheetal has covered. So I would just ask you to recollect of whatever she has told. This is exactly what I am focusing on, what she has mentioned. So healthy eating, go out, work out, meditate. Um, Again, everything is connected. Okay, so we just can't keep mind separate, body separate, your family, your physical health separate, your financial management separate. They all are, at the end of the day, is just part of your one whole. Okay, so it's important that when you're giving time for your financial management, when you're giving time for your social connections, it's important that you give your time even for your mental health, your sense of purpose, and your physical health as well. So just have a brush of whatever these each aspects look like. So the sense of purpose is your motivation, your awareness. So you should know what you want to do. You should know what you like and what kind of person you are. You know, at times when I do sessions and I ask my clients, okay, tell me something about yourself, like how usually in the interviews they say, but then in the interviews they kind of have a fixed sense of things that they are going to say, which is suiting the job opportunity, right? But then if I ask five good things and five bad things about yourself, it's very, very difficult for people to write good things about themselves. They will write 10, 15 things in a minute, which is bad according to them, and they're picking on to them. It's very easy to write, but then they do not know about their qualities, their positive aspects, and their strengths. It's very difficult. You ask your friend, she will tell me better than how I know myself. So that means you're not aware of what you are, what person you are, what do you like, what is your personality. So we know about others, we don't know about ourselves. Not fair. It's absolutely injustice. I can tell 10 things about my child, but I know nothing about myself. I keep thinking, okay, what. So that's the biggest injustice that you're doing to yourself when you're not knowing what you really are. Right? So more things. So have all these things, give priority equally to everything. I'm not saying that you don't give attention to your financial management, which is important, but then I would recommend that you give equal importance to everything. You will start enjoying your life much more than how you're doing right now. So next is, which part of you are in which side of the picture? How many of you are in the left side of the picture and how many are from the right side of the picture? The spelling is almost the same, but the concept is very different. Okay. Are you all having your minds full or are you mindful? I love this picture. Just look at the way how it is drawn, right? The man is walking and he's having 100 things in his mind. So both are walking. The dog is walking and the man is walking. But the dog is actually being mindful, right? He's just observing whatever he's watching. Now, this is the most important exercise that will make you away from all kinds of mental health illnesses. It's a it's a big topic on its own, but just to make you just to give you a crisp understanding of what it is. Now, whenever you're going on a walk or whenever you're sitting with yourself, maybe when you're talking to yourself, whatever it is, just observe what you're seeing. Okay, so you go out to a park, just see the nature, just see what each person is doing. So what happens is your brain gets a message that you're not going to get in the loop of negative thoughts. Okay, so when you're walking, if you're thinking about, okay, what am I going to cook tomorrow, which what will I give in tiffin, what will I talk in a meeting. So all these, if you're going for a walk, you're trying to give time to yourself, but if you're thinking all these things, then your mind is full, right? You're not being mindful, you're actually not giving time to yourself. When you're in your background, a lot of other things are going on. So when you're going out, just observe everything. It's okay, people will come and go. You're not going to sit and comment on people who are passing by, right? This is how your mind learns that whatever thoughts come, you're not going to overanalyze it, you're not going to comment on it, you're just going to let it go. Okay, so this is an exercise which is proven to get rid or help you in getting rid of negative thoughts which keep running as a thread. Okay, so just be aware of your surrounding. So that's how people come and go. In the same way, your thoughts will come and go, so you're not paying attention to it. This is the message you're giving to your mind. Okay, so that's how it will learn. So go and be mindful and not mindful. Okay, very important. This is the least important thing that every person does to yourself. People say that, yeah, I love myself. I go every month to a salon. I love myself. I take care of my nails and my, men may say that, yeah, I go out, party with my friends. That's not self-love. It's a very misunderstood word. This is not self-love. You can love yourself even if you're sitting alone at home. It's about how you're feeling for yourself. It's not how, it's not all about giving gifts to yourself or doing something adventurous. These are all parts of it. But self-love is unconditional. You win, you lose, it's okay. Appreciate yourself for the journey you have taken through it. That's self-love. Okay, so if for example you go for a job interview, it didn't work out, or you had a project, it didn't work out to the extent or the expectations of you or others, it's fine. Appreciate your energy that you put in, the efforts that you put in. That is self-love. Now it's important for you to appreciate yourself not based on the result. So don't be a result oriented appreciator of yourself. So that doesn't count for self-love. Appreciate the efforts you have taken, appreciate for the time you have given for any task that you do, exactly like how you would do to your child. If your child doesn't win a competition, still you would appreciate, right, that you did the efforts, you went on the stage, you performed so well. Exactly the same way you have to do it to yourselves, and that is unconditional love. Okay, you are important. Please keep telling yourself every day when you are before going to bed, just as soon as you wake up, just have a smile, close your eyes and say you are so important. There's nothing as important as you in this world to yourself. Okay, when we start prioritizing others and giving this badge to others and forget ourselves, absolutely unfair. I usually say the best thing how you can rewire your mind, because our mind is, in a society that we live in, has been put up that you have to be the best mother, you have to be the best father, so you keep grinding yourself in this. So the best way to change your mind's wiring is that every night start writing at least 20 to 30 times in a diary the statements that you want yourself to do. Like, you are beautiful, I love myself, you are so important. Write it, keep it near your bed and sleep. Okay, after that, don't use your cell phones or anything. Just have a smile, feel it and sleep, and then see how your mind actually rewires. Okay, so it's not important who values you, it's important how you value yourself. If you are not valuing yourself, nobody on earth is going to value you. Okay, so understand your worth, everything and every person will fall in place. All right, so thank you so much. I think I exceeded 3 minutes. I'm sorry for that. I'm really thankful to the team of Toastmasters that give for giving me this opportunity. I'm sure we would have more collaborations. There are a lot of things to talk about mental health, and I love talking. So I would request next time a little more, 10 minutes more for me. So because I enjoy talking, and it's great to spread mental health awareness. So thank you so much for giving me this opportunity, Miss Anju. Thank you. Any questions? I would be happy to answer.
Thank you very much, Dr. Divya. Don't worry. The 3 minutes is way much more than exactly we need. We need even you to talk more than that, because when you are talking, most of those are straight to the point, like straight to the heart. We sometimes just say, as you said, go to the salon and I'm okay, I love myself. But now we understand, no, it's not about that. It's about our inner worth, right? On how we basically acknowledge what we have and be grateful of what we have. So thank you very much, Dr. Divya, for that very informative session. And we look forward, as you said, for more from both of you, Dr. Shatal and Dr. Divya. Thank you very much. Now we have 5 minutes from each of you to have the Q&A session. So 5 minutes for Dr. Shital and 5 minutes for Dr. Divya. So from the fellow Toastmasters that I have online today joining us, please raise your hand if you have any questions. Let me check who's raising hands. Who would like to ask the first question? I can see a full smile from Toastmaster Kalpana earlier, so I believe she can start our first question.
Yeah, absolutely. Thank you so much for giving this opportunity, and it was an excellent presentation. Both their presentations were amazing. So I would like to raise this question to um, Dr. Divya Salim. Yeah. Uh, Absolutely said, the work and life balance. I have seen many mothers in my community. I live in a community, and I have seen many mothers, particularly working mothers. They are very tired after the work,
Mhm.
and they couldn't contribute much time to their own kids. So, is it very important to give that quality time for the children? Age doesn't matter. Particularly, I know one parent who is really struggling, and I don't know how to. And she is one of the Toastmasters, recently joined, and she's struggling. She couldn't give time for Toastmasters meeting, and she's having three kids. One is in 10th grade, and the other two kids are, hyper. They're having a lot of issues in their families, and she couldn't manage. So, what piece of advice that you would give for that lady, a mother of three kids, and also she's working. So, what a piece of advice that you would give?
Two things here. Firstly, I'm sure she would be in an extreme guilt trip for not giving the time. Okay, so she has to work on herself, that she is doing her best. And more than this, see, there should be a sense of understanding of herself, right? That like I already spoke, that when you are aware of how much you're doing and getting out of that mental stigma that has been there installed inside us, that you have to do all these duties and that's when you are called perfect. This is so much into us that we get into a guilt trip, right? So she has to first work on her guilt. There's nothing that she is doing wrong. She's doing the best, and whatever she's doing outside, that also is she's doing for her kids. So it's not that whatever she's doing inside only is counted as her contribution to her kids, right? So that's one thing. Second thing is, give only, this is the minimum I'm saying, 5 to 10 minutes just before the kids are going to bed. Just be in the bed with them. That will help the kids develop the emotional bond which they feel, or which they might feel that, okay, mom is not giving me time. This is the best she can do at night when she's when there's when she it's the best time that I usually say that have bedtime stories, or if the kids are bigger, just when they are sleeping, just talk to them that how much emotionally, just talk to them that how much you love them and how much you're feeling proud of them. So talk these things, and kids, trust me, they will not have anything against you.
Thank you for
So,
answering that question, Dr. Divya. Yes,
so
now I
the
think
two things is get rid of the guilt feeling and
Yeah,
give quality time for the kids before bedtime.
5-10 minutes before bed.
Yeah, that's awesome. Thank you so much.
great. Thank you very much. Now I can see Janal is raising her hands. Please go ahead and unmute and ask your question.
Thank you for a lovely session. I would like you to put light on ADHD, Dr. Divya, and how to tackle it. It's become a big question in my life recently, that I've seen myself being like a child, very hyperactive
Hmm.
at different various phases.
Hmm.
So, a little tip or here and there, how could I improve on that?
Okay. Now, ADHD itself is a huge topic. The intervention is also very, it's a long process. So there are a lot of exercises that we recommend our clients to do. I can just quickly tell you one great exercise is grain sorting. So it works great for helping your see, ADHD is nothing but there is so much stimulus in the brain because of the chemicals and things like that, so it cannot filter out and see that, okay, this is this is what I have to focus on, right? So it just tries to focus on everything that is coming its way. So the only way to help it is training the brain to focus. So first is, the most important is grain sorting. You can use mandala art. You can use so start with something which is very intricate. Grain sorting is you mix a couple of grains, 3-4 grains, put it on a plate, and just using these two fingers, you have to pick and put it in the respective bowls. That does great for ADHD.
Okay. Thank you so much.
Thank you. Now I can see TM Akmal also is raising his hand. Do you have a question?
Yes, first of all, it was a great session. I'm thankful for both of the doctors. So I have questions first for the Dr. Sheetal. I wanted to know that based on the anatomy of our men and women, like what could be the symptoms in the men and for this breast cancers, because anatomically we have a difference, and
Yes,
all those tools you explained as those more relatable with the women. Can
yes.
you unfold this about the men?
Absolutely. Very good question. So,
Mm.
what happens in men is the breast structure is a very small structure. There is barely a fat lobule there. There is no ductule, no extra structure there. And because of that, when a cancerous cell develops there, it grows very fast because the breast structure for a man is very small. So they might develop puckering or nipple changes. They can develop lumpish feelings, but the pain will come only when the whole breast is involved. So it's very important to note to normal breast structure for a man and a woman. That's the only way you can find out an abnormal structure. But as far as discharge is concerned, when men have breast cancer, they can have a blood stained nipple discharge also, along with the skin changes, and their symptoms are very fast to diagnose because they normally have a very small breast structure. So the moment something starts growing, they do realize it faster, but by then also the breast is so small that it's already reached stage 1, stage 2, and stage 3 in a very short duration of time. So even more important for men to also examine breasts on a regular basis.
Okay, thank you.
Yes.
Okay, thank you for my second part of the question is that's Dr. Divya. So I really I was very pleased to know the self of awareness part, but we only know about as a word like like just a literal meaning. Okay. How can we be better self-aware of ourselves? Is it only about knowing our qualities, or the something on the opposite side of the qualities, or is there is a more better way of being self-aware?
Okay, so usually what I ask my clients is one thing is start writing about your qualities. Okay, so once you start doing that, this is just the initial stage. Okay, so when you start writing about yourself, that's when that's how your mind becomes a little more aware, and you start eventually focusing on your actions, focusing on your behavior, so you will understand yourself better in every action. So you have to stand by and think, oh, I reacted. It's this is just one example, that if you are performing something, okay, for example, once you're finishing that, we don't really think about what went through our mind, how we felt, what was happening in our thoughts, and how we are nothing. Appreciation is zero for our performance. So when you stand back, once you finish, and you give yourself that 5 minutes and realize what all were your thoughts and how you're feeling right now, that's how you're being aware of yourself. That's the time you're giving to understand, okay, these are my emotions. This is how I'm feeling. I'm really happy about how I did. I'm appreciating myself for however I performed. This is how you are trying to understand yourself. It's not that you perform and you just finish and go. No, give yourself some time. That's when you will be more aware of yourself.
All right. Thank you very much for the question and, of course, for the answer, Dr. Divya. As much as we would like to cater to all your questions, everyone, but we have a few minutes left. So we're going to entertain two more questions. And after that, feel free to put in your questions in the chat, and we will try to send it out to both our doctors, and they might be able to give you guys the answers as early as they can. Now, I can see TM Sarah raising her hand. TM Sarah?
Hi, thank you very much. I actually had one question for both doctor, like one each for each doctor. So for Dr. Shital, one thing, I work in healthcare as well, and I see a lot of people asking, why do we have to do, the screenings every year? Is it, I just did it last year. It's too tiresome. It's too bothersome. Why should we go every year? So is there a rationale for like an individual to go every year for the test?
Do the breast screening every year is predominantly only the breast examination, not the mammogram. The breast examination is necessary with a healthcare practitioner once a year, because when you're doing self examination, you will miss many parts of the breast examination when you do it yourself. So it's better to get it done with a clinician at least once in a year. And the mammogram once in a year is not right. Mammogram is needed only once in 2 years, and that too only after the age of 40 years. Until then, an yearly check with a doctor is more than enough. And in case you do find any lumps, they might advise you an ultrasound, but not a mammogram. So, the reason for doing it yearly is in a year, the woman has gone through at least 10 to 12 cycles of menstruation. The hormones have affected the woman during that time, and there might be lumps that might be seen. And that's where the rationale for every yearly clinician check is needed. I hope I've answered you satisfactorily.
Thank you very much. That's great. I'll be using that answer going forward.
Perfect.
And for Dr. Divya, about the mindfulness, I like that. I connected very much with the picture of the mindful and the mindfulness. What is your advice when we feel like our brains are cluttered with all the questions? What is the one thing we can do to switch from a full mind into a mindful,
Okay.
mind?
So what usually we start off is see, it is very normal for us to keep getting the thoughts. Okay, so even when you're doing a mindfulness exercise that you're sitting at home also, it's okay. You just be in one place. For start off with the 5 minutes wherein you're just observing your thoughts. So you're allowing it to just come and go without attaching any emotion to it. So when you attach an emotion to a thought, it gets stuck to you. Okay. For example, if you get a thought that you want to cook something and you suddenly are feeling that no, 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 my child does not like this. Oh my God, how can I cook these things? So you're attaching an emotion to it, or even fear. It can be happiness, fear, sadness, any emotion that you attach to a thought, it gets stuck to you. So when you're trying to practice every day 5 minutes, that you're allowing your emotion, your thoughts to come without attaching an emotion, then you're not going to attach a reaction to it. When the reaction is broken, you will understand that they're just like passing clouds, they will just come and go. So start doing it with lesser time and then start increasing the time. Is it clear? You want me to explain more about it? Because I told you mindfulness itself is a huge topic.
It
Yeah.
is. It just feels difficult to do, but we'll try it a couple of
It
times.
is difficult. It is not easy
Yeah.
because we have lived like that forever. But what I'm trying to say is start off with a shorter period of time. You will understand eventually that it's just a thought. It is not
Okay.
reality. When you're not attaching any other emotion to it, it will go.
Okay.
So try this, keep doing this 5 minutes, then increase it to 6 minutes, and then you will see the change that the over-cluttered thoughts will just pass away. Your mind will just understand it is not important. Because now it feels that every thought is important because you feel it is very difficult to get rid of it. That means you're giving that importance to that thought, that everything is important. So once you start letting go and see it is okay, it is fine, it's just a thought, you will be able to overcome much better.
All right, thank you very much, Dr. Divya. I can see is a question in the chat. This is from Patricia, but I can see Dr. Shital also answered as well. But I think most of us can also relate to this. So, how do we know that it is a burnt out or a depression or just a hormone premenopause?
Okay, so usually there is a checklist that we follow as clinicians for depression. So it is ideal that then you analyze yourself on your own. Just see yourself for good 1 month. If you're experiencing all these things, just meet a clinician. It is better because we have different ways of analyzing the symptoms. So you give it 1 month. If you're still feeling all these symptoms, go. So the clinician can differentiate between if it is depression, anxiety, or if it is a burnout.
All
Uh,
right, thank
can sorry, can I have additional question on this?
Sure.
Because I started to have this vivid, strong, weird dreams that I don't feel that I'm sleeping is like I'm having another life at night, and it's causing like insomnia. And I went to the doctor, I did all the tests. She said that is not hormonal, but I know that sometimes when we do blood tests, the hormones can be normal, but it change fluctuates very quickly, right? And my question is how we can test it, if is hormonal, if is burnout, if is like depression, because it's very similar, right? And if the test is saying that the hormonal is okay, but the hormones is fluctuating a lot, it depends, right? Sometimes in 2 hours is have a big different fluctuation, right? Thank you.
I just have a question to you. Is your anxiety reducing your sleep, or your sleep is increasing your anxiety?
I think nowadays is both. It started. It started by I think a burnout. I was like crying in the office for nothing. After I came home, everything that I was doing, I did work at home, and at to office, and I was feeling overwhelmed with everything. And after the doctor gave me a medicine to sleep, but the medicine started my vivid dreams. She said for continue, but I couldn't manage. I was sleeping like 3 hours.
See,
And
what's happening with you is the medicine is just putting your body to rest. But because you have had so many negative thoughts, or maybe you have stressed yourself so much, your brain is still active in the way that how the thought has a different area, right? So your body looks like it is going to sleep, but your vivid dreams is just because there are a lot of thoughts that are trying to come out, but it is not able to come out because you are sleeping. So, but the most important thing is, see, you have already checked your hormones, that which makes it clear that it is something related to the psychology, and maybe it is not directly related to your hormones. So it is better that you require additional support on this aspect.
I got better, but the dreams is still there and insomnia. I got better. I don't know if it was just like a time or a phase or months, because I checked, but what happened, it looks like my vitamin B was very high. It was very weird report on the blood, and after I did again test blood, and it changed a lot. That's why my question, but I will consider everything, and maybe I will check again. And thank you so much for your support. Very
All
good
right.
session.
Thank you very much, Patricia. As I said earlier, how we wish we could entertain all you guys' question for today for our both beautiful doctors who's with us today. But since we have time, and I know everyone else as well have things to do, so we are going to then say our thanks to both their time given us today for those informative session. I would like to turn over the floor for the vote of thanks and the closing remark to our, of course, beautiful DTM, our chair of the happiness team, DTM, Anju Tokmani. Over to you, DTM.
Thank you so much for that energy that you got in Toastmaster Kenneth. I really have to give a round of applause to your energy, which kept the session going without a pause. Like I was here, I thought it would just like be something boring, but your energy brought in a dash of happiness to the whole happiness session that we conducted today. And thank you so much from the bottom of my heart to everyone who has made an effort to attend this session, because I am very sure somewhere down in the lane of the life, it's not only you, your family, it's your friends, it's the people around you, the people who work with you. Maybe somebody might need that little knowledge that we have got today from the doctors, and you are most welcome to go and visit these doctors. They have already shared, and I'll be sharing the contact details as well. So thank you to the doctors, Dr. Sheetal and Dr. Divya, for accepting my request to be here just on one request. It really
Thank you
means a
so
lot to
much.
me.
Thank you.
And yes, we can have a group picture if we can all just open our cameras and give a happy smile to make this a more happy session. I'll remove the pin. Okay, I'll just take a quick group picture. Can we have all the cameras on so we can capture as many of you who are here with your beautiful smiles? I won't force anyone. I know it's dinner time and all going on. So, okay, I'll take one shot here.
Yeah. Try watching it with your camera. Yeah.
Yeah. I could get one shot, and I'll have to remove the screen and take another one as well. So just give me a second. Yes, I could get it. Thank you so much, and hope this little bit of information will help us somewhere in life. And good night to everyone. Thank you,
Thank you.
Toastmaster Prashant, for organizing this Zoom meeting, and we have got the recording, which we will definitely share with members, so that those who have missed it, or if you want to just go through it again, It will be helpful for all of us. Thank you so much. Thank you, Charu, for being the SAA. Thank you, Toastmaster Akmal, for taking up the timer role just like this. I appreciate every effort here. And kudos to the attendees who made a special attempt. Thank you, Toastmaster Ritu, for this, for being the Greek master here. You can all unmute yourself if you have something to say before we just end the meeting.
Thank you so much. It was indeed a wonderful session. A lot of questions popped uh, to clarify, and awesome. You know, many of my I'm a president of Dubai Tamil Malayalam Toastmasters Club, the only trilingual club. So many of my members also, I told them to join. Unfortunately, they couldn't. So if that presentation can be shared, I can share it to them so that they
Yes,
become aware of it.
definitely. Definitely it will be shared.
That
Okay,
will be
with
great.
this,
Thank you so
Yeah.
much.
yeah,
I would
yeah.
like to add it for the very first time, because there is a taboo that this breast cancer was related to women. I just came to know that we are also affected as a men. So I'm very glad to know about it, and thank you very much, both of the Dr. Sheetal and the self for Miss everything. I really enjoyed it. Thank you, both of you. Thank you.
Both the doctors, they were really good. Amazing. Thank you
Yes,
so much.
yes.
Then
Thank you so
excellent
much.
presentations.
Very well explained by both the doctors.
Thank you.
Thank you so much.
Thank you, Toastmaster Rekha. And with this, I'll end the meeting. Good night, and again, wish you a happy dreams. Okay, don't dream about cancer and mental things. Okay, just live in the moment. Forget this year, and let's be more mindful. Okay.
Be
Good
happy, be
night.
healthy.
Thank you.
Good
Thank you.
night.
Good
Happy
night.
Good
evening.
night.
Happy good night.
Good night. Bye.